Gupta has
There
pointed
are
out.
Dr. Guptas, yes.
You know, this is complex. So the CCG does not commission GPs to deliver their daily GPing. However, we are now very much engaged in driving forward the strategy for what primary care will look like going forward. And we're working extremely closely with NHS England and even more closely with our colleagues in public health particularly, but also more widely with Roger and his team, because the solution going forward is not just about GPs. In fact, it's probably least about GPs in a way, because we have got to look at a different way of providing the care that the people of Thurrock need. I have one person who delivers the drive, who does the strategy, if you like, for primary care, but the CCG has been successful in gaining a bid for £100,000, which is allowing me to staff a whole department for 1 year to actually drive up the quality of the governance and therefore some of the delivery in primary care. So we're going to be looking at the widest determinants of that primary care through things like policies that make the delivery safe, so health and safety, infection control, management of drugs, all those sort of things. But we're also going to look at referral rates. We're going to look through the work that Ian's done, and I'll ask him to talk to that in a minute, to look at the actual outcomes for patients. So I just wanted to give you that sort of widest perspective. I'm going to go briefly to the paper, but I think we will talk more widely than the paper actually is at the time of writing. But just going through the individual items, we had a very, very successful public consultation in Tilbury. Because as you'll all remember, the last time we were here talking about primary care, we had the issue of the CQC going into Tilbury, taking out some of the providers, and we were particularly challenged about provision there. Councillor Rice was present at this particular evening, as were my council colleagues, and we listened very closely for 2.5 to 3 hours to the people of Tilbury, and I think we were not surprised by what we heard, but what it allowed us to do was to go away and begin that dialogue around the facilities and the provision that we want to bring to the people there. And again, we'll talk a little bit more widely about that, and I'll refer to Ian. Now, a lot of this is predicated on the current estate that exists in Tilbury, but more widely across Thurrock. And one of the things that has been handed down, if you like, from NHS England to the CCG is the responsibility to look at the estate's provision. So we're doing a piece of work to actually map the estate, but more excitingly, we are focusing on the regeneration in Tilbury and this particular new build option, and also the regeneration work that's going on in Purfleet, the build there, and the new health facility that will emerge there. And to that end, we held a workshop last Friday where we had all stakeholders, including estates from all our providers, as well as representation from the CCG and from the local authority. So work pushing ahead really fast there. Section 2.4 talks to our out-of-hours service, SEEDS, which, if you remember, again, we discussed this at the last meeting. This is the South Essex Emergency Doctors Service, which has become challenged to a point where it's no longer viable. And approximately 14 of the 32 practices in Thurrock use this service for their out-of-hours, so Thursday afternoons, evenings and weekends. This service has now ceased to provide out-of-hours services to those practices, and now every single practice in Thurrock is covered by IC24. But I know Councillor Rice asked me last time about location. The location will remain the same in Thurrock community hospital. So from the point of view of the patients, they shouldn't feel the join. But just to say now, this is a service that is commissioned by the CCG for all the practices in Thurrock, so we don't have this half and half arrangement. And that commenced today, in fact. So that's good news. Our locality-based weekend hubs are going from strength to strength. And what we're doing with those is we are literally going round an assessment loop to look at, we started with Saturday and Sunday mornings, one doctor, one nurse. We are continually tweaking that provision. So for example, in Tilbury, where every appointment with the doctor and the nurse is fully booked every single weekend, we've actually built in extra capacity. In the other 3 hubs, Sunday is proving less popular, so we are moving capacity, either nurse or doctor, either to Saturday, or we're beginning to look at different options where we might perhaps have, say, a consultant from the hospital come out and do some work around long-term conditions. So people who've got diabetes, who've got high blood pressure, looking at health checks for them so that we're making sure that their management is effective. We're also working on the IT platform that will allow these hubs to take emergencies as well. So if you remember, if you have an emergency, you can ring 111, and we're building in the IT connectivity between 111 so that they can refer a certain cohort of patients who would normally need to be seen probably within 4 to 8 hours. So not the emergencies that need to go to A&E, but those patients who need to be seen at the weekend but don't need to be seen immediately now in A&E. So that work is planned to complete by the end of January. Number 2.6, which is the general issues, and we will talk to this when we come to the success regime. Recruitment of both GPs and practice nurses remains a chronic problem. And I'm just going to ask, if you don't mind, Chair, just to ask Ian just to talk through the work we've been doing looking at the needs assessment, particularly for Tilbury, but we're doing the same piece of work for Purfleet and across Thurrock, just to look at how we can deliver a model of care that doesn't always rely on the GP. So Ian, can I ask you just to...
Okay, thank you. Sorry, I wasn't expecting this one. I haven't prepared any figures. But from memory, as Mandy said, Thurrock has some of the worst levels of underdoctoring and undernursing in the country. By that I mean the number of patients cared for every full-time doctor or nurse. And that leads to some chronic problems. Essentially, these services are reactive rather than proactive because you've got all these hundreds of patients coming through the door every day. And what we are not doing well is management of long-term condition care. In fact, looking at the data I've looked at with Thurrock, it's some of the worst levels of long-term condition care, tertiary prevention, that I think I've ever seen in primary care. And that has some terrible consequences. It has terrible consequences for the population, and it has terrible consequences for the health and social care system, because people end up in the most expensive part of it, which is Baston Hospital, and then down into Rogers adult social care packages. So we have to do something differently. There's something about build this and they will come. So it's difficult to, it's quite typical in areas which have high levels of population needs. It's difficult to attract GPs, and it's difficult to attract GPs and nurses right across the country. So if we can build something amazing in terms of a multidisciplinary or several multidisciplinary centres, then that suddenly becomes more attractive to GPs. What do we mean by that? Well, we want a multidisciplinary workforce in terms of primary care, so that, yes, includes adequate GPs, but adequate practice nurses as well. It might include a wellbeing worker, it might include therapists, it might include mental health counsellors, because we know mental health is a huge problem in certain areas of Thurrock. It may include practice pharmacists to look at medication reviews. It may include services for wider determinants of health. For example, we know that about between 10 and 15% of GP appointments are taken up by or with patients with issues that are not actually clinical. They may be social, they may be lonely, they may be bereaved. They may have a housing problem, but it's the GP that actually takes the flak of that. So by working in a multidisciplinary way, we can A, hopefully attract GPs into the system locally, and B, become more efficient in the way that we can proactively deal with patients. The other finally I just would like to add is that whilst we started with Tilbury and Purfleet, partly because there's high need, but partly because there's an opportunity in terms of the two regeneration areas. But I would like to recognise that actually primary care across Thurrock is an issue, and the next piece of work that we will be doing is a comprehensive needs assessment looking at primary care across the piece, looking at all GP practices. So I don't want this committee to think that we're concentrating purely on Tilbury and Purfleet to the exclusion of other areas.
Thank you, Ian. Alistair, do you want to add anything from your commissioning perspective before I've got a couple of points just to finish off with?
I think just to echo the point about the difficulties of recruiting GPs across the country, actually, I think it's quite a challenge. I think the model that you outlined there, Ian and Mandy, about a new vision in a way for primary care and what primary care might deliver must attract younger GPs. That is different from the model of maybe 40 years ago, which was single-handed business-based arrangements with partners in practice who invested in bricks and mortar. People now want a part-time arrangement, they want a salary role, and we need to respond much more quickly in finding options and solutions that are going to attract more people to do that. And if you can go early with a shiny building and a new model, then you might get to be the leading light in doing it. So it's very exciting work.
That's all right.
Oh, thank you. Just a few points to finish up with. So going back to the weekend hubs, there'll be a piece in the paper outlining the extra cover for primary care that we're proposing through the holiday period. So not only will there be weekend opening, but there will be evening openings as well in the hubs, and these will be well publicised. The two practices that fell as a result of the CQC are now staffed and managed by College Health, who work out of Thurrock Health Centre and are obviously delivering a high level of primary care there, particularly reviews of patients with long-term conditions, just to ensure that every patient is seen that's on the list there. So a very thorough review of all the patients registered with those practices has been undertaken. And just to say that the solution to all of this is multi-provider as well. We have got fantastic engagement from Basildon Hospital working out into our new, we'll build it and they will come. Likewise, through mental health, SEPT, we have a new provider for IAPT, for the psychological therapies in the community, which is actually coming from Staffordshire. They want to be based in these new buildings out in the community. And also, likewise, Nelft, they are very committed to moving and be co-located with all these other services. So it was difficult to put all of this into a paper because it's really fast moving at the moment, and I think it really is probably one of the most exciting things we're actually engaged in currently.
Thank you, Mandy, for that comprehensive as ever report. And it's nice to hear such positivity coming through as well. I mean, it's we get a lot of doom and gloom around here sometimes, but it's nice to hear something a little bit more positive. Questions, Councillor Howland?
Yeah, thank you, Chair. I like the phrase build it and they will come, because I think that's what we need to do. Because if we're not forward planning, we're just forever going to be fighting crises like we've got in Tilbury. But I came to committee in July because I wanted to talk about GP services in Corringham, and I was told then an estate plan was coming in December. So after that meeting, late July, early August, I sent a letter to NHS England, to the council, to the CCG, outlining some of my concerns about service provision in my neck of the woods. I didn't get a response. I then came back to committee again because I started to hear phrases like estate plan for Tilbury. I thought it was an estate plan for the borough. You can actually see in your minutes this evening that when I came back in October, Council Hall requested confirmation that the estate strategy referred to in the primary care section would be for the borough, not just Tilbury. Officers confirmed that this was the case. And now we've got a report in front of us that is largely just concerned with Tilbury and dedicates just 7 lines to the rest of the borough and virtually no reference to Stamford, Stifford, Chadwell, Chafford. Yeah, I think there's a lot of really positive stuff that you mentioned this evening, so I don't want to pour cold water on everything, Chair, but surely you can understand what my concerns are as an elected member, that we hear tonight that it's now the next piece of work that we're doing to look at GP coverage across the entire borough. We've been told in 3 separate committee meetings that we would have an estate strategy for December where we'd be looking at GP coverage across the piece. Now, is there positive work in here? Yeah, absolutely. Is there progress being made? Absolutely. But it still feels that we are managing a crisis in Tilbury and we keep on talking about build it and they will come, and thus far we haven't actually seemed to move past talking about build it and they will come. Now, as an elected member representing Corringham and Stamford, I want to start to see plans about how we are going to build it in Corringham and Stamford. I'm sure Councillor Snell wants to hear for his constituents in Stifford and Councillor Keith for his constituents in Chafford. And so far, despite repeated requests, I'm really just not seeing it. So can someone please try and
Calm me down.
calm me down?
Calm you down. Okay. Corringham particularly is much better provided for. And this was the reason why I suppose wanted to manage expectations. I have 1 member of staff working on this, and I can't deliver a solution that no other organisation has delivered in a lifetime overnight. So that's the first thing. Certainly the 4 hubs, the Corringham hub is working well, as all 4 of them are. As I say, the Tilbury one is under more pressure because of the shortfall there. You've got some good practices in Corringham, so the Corringham hub doesn't get the weekend pressure. The estate strategy, our timeline is to have a first draft by the end of December and a final draft by the end of March. Again, a whole lifetime of a PCT didn't sort this out. So 1 CCG is not going to sort this out overnight. And still, the actual funding for estates does not sit with the CCG. Yeah. It sits with yet another organisation. So again, trying to just temper. But I think certainly we are very aware, and your point is completely well made, that we can't look like a perfect Tilbury show when we've got to graze Corringham hubs as well. So we're absolutely aware of that. And I think the wider development of the multidisciplinary approach that Ian talked about will be replicated in all 4 areas. I mean, that is an absolute given. But personally, I think given the resources we have and the commitment we have, I think we have delivered a lot of thinking, because it won't surprise you to know that anything that is delivered in the health service is complicated, because the responsibility does not sit with one body. So I don't have funding to deliver GPs, that sits with NHS England. I don't have funding to build buildings, that sits with NHS Property Co. So the fact we've got buildings that are hopefully going to be built by the council actually moves us along more than you can possibly imagine, because it takes away one organisation from having to be on the playing field, if you like. But it's the single most important thing we will do for the people of Thurrock, is to get our primary care right and to get new models that actually are whole system. When I come to the success regime, this idea of place-based service. So this isn't about organisational boundaries, this is about a service that's delivered in a place and everybody comes to that place, but you again won't know that that's the mental health trust or that's the hospital. The services will be there in a locality. So I hope I'm not trying to make excuses, but Corringham is just as important, but it is not as challenged as the other two areas at the moment.
Mandy, you mentioned the draft plan will be possibly ready in December. Would that be in a format you'd be able to perhaps email the members of the committee?
Can I discuss that with you, because it's going to be very. I'm not sure in my own head what it's going to look like, because I've managed again to secure some funding to bring in some experts, because this is not an expertise that sits in the CCG estates. We've managed to bring in some experts to start doing this. I'd be more than happy to sit down with people, but I need to understand, particularly with Ian and Roger, to look at it and say, what is it actually telling us? And therefore, what do we do as a result of this? And particularly with NHS England, where the estate's brain sits, if you like. So, more than happy to share, but it's got to be something that makes sense to us first.
Okay, thank you, Mandy. Yash.
Thank you. I think we have been facing this problem of the primary care for 20 years. I've been involved with the PCT in the first place, and I was very pleased what Ian said. And I remember in the very first meeting, 2000, when the PCT came and PCG started, we actually were talking about this. How can we, because the shortage of GPs has been a chronic issue here, and I think at that time we were thinking about that you have to look at the preventative side of it, and unless you have got multidisciplinary teams, you can't really sort out the problem of the primary care. It's much more important to put money on the preventative side of it than on the treatment, because the emphasis in NHS is always on treatment. And I think that these multidisciplinary teams, because again, perhaps I'm talking nearly 40 years ago when I came here, we had a multidisciplinary team, child guidance clinic, where we used to have 6 different type of people who were working for preventing on the one side and treating on the other. But and I think this is a good idea. But as you are saying, Manny, that health structures are so bad that they wouldn't let you do anything really and truly. If one side suggested something different, the other side will come in and will create problems, and it will take years and years and years. And you can well imagine when PCT came here, the people like me were very enthusiastic. We thought we were going to improve primary health in a great way now, because health authority is gone. And we have our local people, doctors working with us and all the rest of it. But sadly, after that experiment failed really, miserably in my opinion. And as I said, I will be very pleased if what he has told us today, if there is a real implementation plan, and there is some sort of a cost and some sort of a time period goes with that, then we can assure the public that yes, people are now really doing something very positive to maintain health in a proper way for all the population, not just one area or the other, and remove health inequalities.
Thank you, Ash. Steve.
Yeah, personally, I welcome the focus on Tilbury. I think when you've got such a huge problem across Thurrock, and your problems are in Tilbury and they are in Purfleet, then you have to focus where those problems are. Otherwise, trying to tackle everybody's problems all at once, you're not going to get anywhere, basically. And I'm very keen to find out what the plan for the future is really, in terms of the project plan for getting this health centre multidisciplinary team in and running and the building done. You know, that's a big job in itself. Have we got that sort of under control, and is that on the way?
Do you want to answer that or jump into it?
Well, I can start. For me, listening to this commitment from councillors to the building is fantastic, because that is, I guess, the first step for us. We have an estates group, and we have we have Rebecca, who leads for the Tilbury regeneration. We've also got Matthew Essex on that group, and we are looking at both Tilbury and Purfleet together. But as Roger will support, the actual, if the council can build the building, then we are up and running. That is, I think, I mean, Roger and Ian, feel free to contradict me, but I think that is, you know, once we put the first brick in the ground, then we can, through a very comprehensive service specification based on the work that Ian's done, we can now start building those services in that building. We've got commitment from the community provider to move in. We've got commitment from our psychological therapies people. We're talking to Basildon Hospital about services we can move in. We've got one, possibly two GP contracts, but again, in my conversations this evening with Alistair, we know from Ian's work that we have X number of GPs, but we need X plus quite a few more. So it's getting that building up as soon as possible. So I'm going to ask my council colleagues if they just want to add anything to that.
Just a business case will need to be agreed, but we are quite well underway in terms of putting that together. I think there is a commitment, and I know it has been to the assets group, and it will need to come back through cabinet to sign it off. But it looks as if there is a business case that will stack up. We need to get commitments about who the partners will be and the revenue stream and the length of the lease, and there's obviously some detail to work out. But the business case will be coming through to cabinet sometime early in the new year.
I don't think I have much more to add to that, actually.
Fair enough. Which case?
Thank you, Chair. Mandy, I've just got a question around these seeds. I know you weren't at the meeting last week for primary care, but there was a bit of a to-do over the Thursday afternoon closing of the GPs, because a lot of them still close, and it was understood that IC24 were not picking up Thursday afternoons, and there was a little bit of a fallout, should we say. So I just wondered if there'd been any update on that, please.
All GPs are contracted to open on Thursday afternoons. The closure and the cover on Thursday afternoons is not the responsibility of the CCG. And as such, NHS England have made it abundantly clear to those practices that they expect them to open on a Thursday afternoon. And there's a piece of work by one of Alistair's team to work that through. If they do close, then it is their responsibility to commission that cover on a Thursday afternoon, and it will not be IC24 because they do not have the capacity.
Thank you, Mandy. I think you've covered what I was going to say. We expect the practices to open on a Thursday afternoon, so we'll be looking to enforce that. Kim, so if you've got any intelligence which suggests there are issues, then please let me know, and I will address it.
Yes, we will, because we are intending on doing a Thursday afternoon piece of work. That's all I'm going to say. Because a lot of them, there was a lot said on that day that we are going to. That's what we do, and we will. So it's about what is going to be in place if they do.
Okay, let's
it's too much, but just in response to Councillor Lydiard's point, I totally agree that the acute problem is in Tilbury, so of course effort should be focused at Tilbury. I would never suggest anything otherwise. But this mentality that build it and they will come, attract new, better, younger doctors, is the right thing to do. Perhaps if we had had a more joint up plan 5 years ago, 10 years ago, 20 years ago, the Tilbury sort of problem wouldn't have cropped up in the first place. And that is why we need now, not just to say, deal with the problems in areas like Tilbury, but how did that arise? How do we prevent it from arising across the borough? We need a joint up plan to get a proper GP estate strategy across the entire borough. This is the third committee meeting now where I've come and spoken about it, plus a letter, plus lots of informal conversations as well. And now the estate plan that I thought we would be scrutinising this evening, apparently will be ready at the end of December, but won't actually be ready in a form that we can actually have it sent to us so we can actually digest. But there are lots of positive things that are being said at the meeting, and I'm not discounting it. Some good work's been done, but thus far there's nothing in black and white that we can actually look at and say that on behalf of Councillor Key's constituents in Chafford, mine in Homestead, yours in Stiffer Clays, Chair, that this is what it's going to look like. We've just got this vague commitment that we think we're going to get it right in Tilbury, and then we've got a vague commitment that we might roll it out across the rest of the borough. This is 4 or 5 months. This has been rumbling on now. We need something more coherent. And between the council, the CCG and the NHS, there's got to be someone who can actually grasp the nettle and say, we'll put something down in paper, and that will be the embryos of a plan for Thurrock. I'm not saying show me where you're going to build a massive replica hospital on my ward right now. I'm just saying show me some of the building blocks of what we're going to do.
Barbara.
Thank you. Well, firstly, I welcome the seeds plan, apart from the Thursday afternoon that I know Kim will be doing some work on. But certainly the coverage of all GPs is really, really welcome, Chair. And I think that you have to be applauded on that, Mandy, because before it was only certain GPs that were aligned to that service with seeds. So that if you were registered with some GPs, you couldn't go to that out-of-hours service. It was quite messy. So now this really is an all-over-the-borough service, and I think that it's welcome. I know certainly residents have said to me they're very pleased it's in the same place as well, Mandy, so well done for that one. First of all, going to the Tilbury project, the Tilbury premises development, I would like to see firm commitment all the way round that this is not going to languish and that we are going to move ahead full steam with a commitment from NHS England, from the council and etc., to make sure that we move ahead. And we're not going to be sitting here this time next year with the residents still saying to us, this hasn't, you told us this a year ago, what are you still talking about it for? So full steam ahead, I think, is the message on that one. Secondly, around the plan for the whole borough, I totally agree with James that the borough of Thurrock certainly does need not just an estate plan, but an estate to a plan to improve our primary care. And I don't really agree with you, James, that in the last 4 months all we've done is talk about it. I think that's totally wrong. Since Ian's been imposed, he's absolutely analysed the situation down to its knuckles, really. And that's where all of the information that we're currently using has been coming from. And I thank Ian for really doing a fantastic job on providing the data to give us the starting blocks, if you like, of what is necessary. I know that you're a councillor for your ward, and you rightly, absolutely should be commended for sticking up for those. My ward in Chadwell is almost as bad as Tilbury with the GP coverage, so we're no better off in my ward, and certainly I've got a little group now that I've got together in Chadwell to talk about the issues. So we're none of us better off really than others, and it's just a matter of all hands to the pump. Let's get the priorities done, and the priorities are done through data and through need, James. That's how they've been organised. So, and I think that's a fair process. But running alongside that, I agree with you, there should be a plan in place to move forward.
Sorry, Chair. I didn't suggest that Ian and NHS staff hadn't done a great job. They had, but we're the elected members. This is the report put in front of us to scrutinise. There is nothing in this report that addresses long-term GP access, long-term GP recruitment in areas like my ward, Councillor Snell's ward, Councillor Key's ward. Nothing in here that addresses that. But more to the point, I came here first of all in July and we said we would have that plan. I clarified in October that we were going to have that plan. We were going to have that plan. We're here. We don't have that plan. So I'm not saying that the need of Tilbury should be overlooked. Of course I'm not saying that. And I'm not saying that the staff haven't done excellent work. They have. But I'm saying we were told we would have a plan. We do not have a plan. And for all elected members, we should be concerned with the issue of making sure we do have a long-term vision and not just constant crisis planning. Because that's all we do. That is going to be our full-time occupation, crisis planning.
I completely accept what you say in terms of we have a huge problem about underdoctoring in Thurrock. In fact, I think of our 32 practices, only 3 or 4 from memory have a level of ratio of patient to doctor that is matching the England mean. I think this is a historical problem that has been left to get worse and worse over the last 10, 15, 20 years, certainly as long as I've been around in this area, and we're not going to solve it overnight. I can't comment on the promises that you may have been made, but just to manage your expectations, what we've got to do is get this right. What might be right for your area may not necessarily be right. The right model for Tilbury may not be the right model for Councillor Rice's area, and may not be the exact same model for Purfleet. I've got 2 analyst staff, one of which is on maternity leave, and we have worked hugely long hours to analyse this in detail for Tilbury. We've now moved on to Purfleet, and so the reason we've primarily done this is because there's an opportunity in terms of the regeneration that's coming in. So I just want to manage your expectations. We absolutely will do it for all of Thurrock. We need to do it for all of Thurrock, but it's taken 2 months of really hard work, and given that we've left this for 10, 15, 20 years, let's just get it right. If you can just give me time to get it right.
Anybody else? Yeah, okay. What I'd like to say is I agree with the point